If we're going to change the way that we do business and we're really going to be innovative and help support communities, we have to change the way we think about it, and we have to be open to the possibilities of what can be. Working with Amazon is part of that. Washington State is a public health agency. It's different than healthcare because healthcare is a very individual interaction. What we do is go broader. We are essentially what I like to call is the community's doctor. How do we improve the health and well-being, not for just one person, but everybody? So that could be policies, that could be programs, data, epidemiology. We look at, disease trends and where outbreaks are happening. What we want to do is prevent people from getting sick in the first place. During the pandemic, there was limitations as public sector of what we were able to do. The cascade and the need to do mass vaccination to get data out now, we just were not designed for that. AWS in particular helped us with our chatbot. So that chatbot we set up, it would allow, you couldn't take in calls from 8 million people. The chatbot helps us eliminate some of that problem. The other function that we have, which is really the gold star for nationally, is really our testing program. How do we allow individuals to order COVID tests from home? This was during the same time that the federal government was rolling out their COVID testing program. The challenge was it might take you 2 weeks or a week to get a test. And so the beauty of what our partnership with Amazon was that you can get a test, you can order a test, and most of the time, you got it the next day. It came in an Amazon box, so nobody knew that you were ordering a COVID test. We really focused on equity and vulnerable populations. So what we did is we allowed the portal to be opened 2 hours before the general public for communities that we knew that were disproportionately impacted from COVID. On the back end, it prioritized those zip codes and those neighborhoods where we knew there was high disease trends but less resources there. It was a great experience because we had individuals who understood what was at stake. In government, we're not used to scaling up so quickly. For us to think about reimagining what could be possible and to be able to do it fast and quick was incredible. And having individuals on all sides that had their skin in the game and really wanted to help protect and save lives, I think it was completely beautiful. Part of the programs and services that have grown out of the pandemic is now we launched the first ever Amazon SNAP program in the country. Anyone in our community, if they're on SNAP, can order from Amazon online and get it delivered, which is a huge equity-focused effort for us because we're meeting communities where they are. Sometimes you may be sick, sometimes you might not have a car, transportation can be an issue. So being able to order food online, get it delivered to you is a huge game changer for us. You have to think in the long term. We immediately start to try to put Band-Aid solutions about what we need right now. And what we have to be able to do is think about the 2, 3, 5, 10 years from now and start building those systems that we need to help engage community and help us be more innovative. Be willing to be open and curious about what the possibilities are. And that will then move us from being transactional to transformational.